Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back, and thank you for joining us today on Between Two White Coats. Today, Amber and I are trying to make some really common things a little bit more simple and help you understand them. So today we're going to talk about hyperlipidemia, which is our fancy word for high cholesterol, and what is it and why you should care.
And why we want you to care so much. Hyperlipidemia, or elevated cholesterol, is something that can cause significant heart disease. And so with that being the number one cause of mortality and morbidity in the United States, it's something that we're very passionate about, and most patients aren't as passionate about it as we are, though. They just are not.
Honestly, you want to talk about a silent killer. I like to describe this to people by saying you're putting grease down the drain. And, you can drip, just consider a little drop of grease down your drain. And the drain is not clogged until the drain is clogged. So as long as some water is moving through there, you may not even recognize that there's an issue.
Every now and then.
Maybe once in a while you can try to open it up. But for the most part, when you're putting grease down the drain, it is just a matter of time before you're going to have a full clog. And that's what high cholesterol is. Cholesterol is the fats in your bloodstream, and when the fat starts to build up on the lining of your blood vessels, it's like grease in your pipes. And so it's going to little by little start closing in until it creates an entire blockage. And the day before that entire blockage, you feel normal. And then when you can no longer get any blood through that vessel, it creates a serious problem. If you have this blockage in your brain, it's a stroke. If you have this blockage in your heart, it's a heart attack. There are a number of other blood vessels to your legs where you can get peripheral artery disease, your carotids where you can get carotid stenosis, your aorta can start to get plaques. We used to call this hardening of the arteries, where cholesterol has some calcium buildup. And so the blood vessels will actually be hard from the calcium. And then we've kind of lost that phrase, but a lot of people may know it as that. But it's really the cholesterol plaques that are building up that are going to end up blocking off your blood vessels, and you're going to have serious consequences from that. And until the moment of the heart attack or stroke, you feel like you're normal. You do not feel high cholesterol buildup, which I think is one reason why people really don't want to do anything about it. Let's talk a little bit. A lot of times people will tell me my cholesterol was, and I'm like, which cholesterol?
Yeah.
And so it is difficult sometimes to understand what are the different types of cholesterol, and science is expanding, and there's becoming more and more of understanding.
Yeah, there's
cholesterol.
whole cardiologists that just are lipidemiologists.
Yeah, they just do lipids.
They just treat cholesterol.
Total cholesterol, the most common cholesterol panel is broken into a total cholesterol, an HDL, which is your good cholesterol, an LDL, which is your bad cholesterol, and triglycerides, which are another bad cholesterol. Your total cholesterol should be below 200. Your HDL, we would like to be above 40 or 50, depending on your gender.
Which that confuses people sometimes too, because it's high lipodensity proteins, and so or lipids, and so we your good cholesterol, we want that to be high, and so the other cholesterols we want low, and so I think that is confusing to people.
So the HDL we believe to have some effects to be cardioprotective, and so when that number is high, it may help prevent heart attacks and strokes. And so we want that cholesterol, so that type of cholesterol we want to be high. All the others we'd like to be low. And the LDL, we would like to be below 130. But if you have a history of heart disease, we're going to push that down a lot further, really below 70.
And diabetes.
If you're a diabetic, we're saying it needs to be below 100, but probably better below 70. And so the LDL is probably where the most power lies right now. Certainly over years, we learn more and we put more emphasis on one type of cholesterol or another. But the LDL, I think, is where the cardiologists are saying really push that LDL down. That's where we're going to have the best prevention of heart attacks or strokes. And then the last type of cholesterol in that typical lipid panel is the triglycerides. And we'd like the triglycerides to be 150 or less. So we can see that cholesterol is made up of many types. And over time, we used to really put more emphasis on the HDL and think, wow, it really can cancel out the LDL. But now we believe that maybe it's not as cardioprotective as we would hope, and the LDL is really where we're putting a lot more energy. And I will say, if you see a cardiologist, they do this all day, every day. They're going to really say, get your cholesterol down, keep your cholesterol, below 100. That's going to be where you have the most protection. And so if someone has been putting grease down the drain and it's starting to clog the pipes, we're going to be able to see that through your cholesterol panel. Now, when we look at your cholesterol, we're drawing out your blood and we're just looking at the cholesterol that's in your blood at that time. So this is best to be fasting labs. There aren't a lot of labs that require fasting. Your fasting sugar level does for looking at diabetes. Your 3-month sugar level, the A1C, does not require fasting, but the fasting sugar does in the diabetes arena, and cholesterol really depends. So if you're concerned about your cholesterol, you're getting blood work to monitor cholesterol, that's where you want to fast for labs. And I always like to throw in, if you're fasting for blood work only, drink water, take medicine, just don't eat. If you're going to surgery, it's a different story. But just so that, people come in and like, I didn't drink any water. I'm like, well, that's going to be harder to get your blood out and it's going to collapse the vein easier. So when we, are talking about cholesterol, we will look at what your cholesterol panel is right now. That doesn't necessarily tell us if you have had cholesterol issues for a long time. Are we at the beginning of putting grease down the drain? Are we at the end and we are starting to see that there's some clogging going on? And so we can also look at the blood vessels themselves to see if there's a cholesterol buildup. And if you're a person who's had borderline cholesterol, or if you have a family history of heart disease, or you're kind of figuring out like, do I need to do something about my cholesterol or not? One of the things that we can look at is a cardiac calcium score, and that looks at actual cholesterol buildup in blood vessels.
Interestingly enough, those are not as expensive as people think.
So this is a CT scan, which seems like it should be expensive, but a lot of places do them for cash for $100 or less. So it is an affordable test to do, and if the cardiac calcium score is high, it tells you that you've got grease building up in the pipes.
Well, and the lipid panel, so the fasting labs that we would do, that would be something that we are going to screen on your annual visit. So that's why we always push preventative visits. But that's another reason, is that that's one thing that routinely, if you see us or anybody else in the country, a screening cholesterol lab is typically done at all annual visits. And so that's a really good way to put a pulse point on kind of what your cholesterol is once a year.
And then the question becomes, where are you in the clogging the pipes? And how proactive do you want to be? If we see that your cholesterol level is high, and maybe you're young and you haven't had heart attacks and you don't have diabetes, is that time to be aggressive and start lowering your cholesterol? Depending on how high the cholesterol is, I think, is whether we go straight to prescriptions or whether we look at lifestyle changes first. Decreasing the fats in your diet will definitely have an effect on cholesterol, but more than half of your cholesterol is genetically determined, and so you can make diet changes and still have a high cholesterol, and there's only so much that you can control there. I myself am on a statin drug for cholesterol, and I am very healthy. I don't have any heart disease at all. I don't have heart disease in my parents, and so I don't have other diabetes or smoking or other things of that sort. So, I easily could have said, hey, I've got kind of a borderline cholesterol here. And, my LDL was about 140, but I just know what happens if you just keep putting little drops of cholesterol in the drain. So I thought, let me get my cholesterol down. I had tried diet. I know what to eat. I was actually following the advice that I give other people. And my cholesterol just wasn't budging as much as I wanted. And so I started a statin. I got my LDL way down, and I've been able to keep it down without using the statin. And I feel much better about that. Now, I do sickness for a living, so I certainly may be more proactive than other people might be, but I think it's worth entertaining in the early.
Yeah, well, then now you're able to be off of it.
Yes.
So that's the thing. Like, I know a lot of people are so worried. People will often take diabetes meds and high blood pressure medications so much easier than the cholesterol medications.
Oh my goodness.
Like, I literally have to almost beg someone whose LDL, like, I'll see people whose LDL is 180. I mean, we are talking significantly elevated. And there is like a risk assessment that we do. It's the ASCVD risk assessment, 10-year risk assessment. And so I'll use that often, but at 180, I'm like, I mean, you can eat lettuce, but I'm going to need you to take this until you can bring it down.
Yes, if your LDL is 160 and above, you need to be thinking about this. If it's 170 and above, you need to get it down and take whatever measures are necessary. But you are right. I do not know what in the world happened that made people think that statins were poison. Statins save people from heart attacks. Well, they are very good drugs, and we give people a lot of pharmaceuticals that make people a lot sicker, and they do not have the bad reputation that statins have.
Well, and I always will tell patients, like, they're like, well, can I try diet and exercise? Absolutely, 1,000%, because I'm going to hone in on that too. But in the meantime, let me help you get that down, because if you have a cardiac event, have you ever seen a cardiologist give a patient a suggestion of a statin? No, they're like, you will take 80 milligrams of this statin because you now have clogged artery. Like, we are too far.
Once you've had a stroke or once you've had a heart attack, we really would like you on a statin the rest of your life because it's going to prevent that second. And if you think, you're putting grease in the pipes, do you think just one tiny little area of pipe gets a grease buildup? No, it's everywhere. So maybe it was your heart at this point and you had a heart attack, but you've got grease everywhere else. So it's probably going to be your brain next time or another heart attack. Or you hear people go, oh, I had 4 vessels bypassed because they were all clogged. And so you're going to end up on a statin for the rest of your life. So I think being proactive early and really trying to get the cholesterol down and then being able to make your lifestyle changes to keep it down. And of course, we are advocating for you to go on a low-fat diet. Make sure you're eating those healthy fats.
Supplementation, like, I encourage patients to take fish oil and CoQ10 and some of those things as well. And there are other options besides statins. So it's not just a statin, but statin is like gold standard. We want you to be on a statin if at all.
They are very effective. It is. We do not get paid by the statin company. It is the research that supports that statins save lives, and that is why they are recommended. And there are, a smaller percent of people who will get muscle aches on statins, and it's certainly the lower percent. So you could try a statin, and if you're not one of those people, don't worry about it. And if you are, then there's a lot of research that supports taking a statin every other day or taking a really low dose. There are different statins that are less likely to do that, and so there are a lot of different options. There are other cholesterol drugs that also work well, but statins are really a gold standard for lowering cholesterol. And again, the number one cause of death in this country is heart attacks, and the elevated cholesterol is what's causing that.
Yeah, and I've seen familial hypercholesteremia. That's a big, and that's a very difficult thing to treat. And so if you're on those medications and you don't see that stuff is coming down, or if you're like, oh, my grandmother and my mom and my sister and everybody has high cholesterol, then we need to look at that too. There's a different test that you do for that, but that also significantly increases risk. So,
yes, and so this is a genetic disorder of increased cholesterol, and it's not as dependent on your diet at all. And the recommendations are to be very aggressive very early, because these are the people who are having heart attacks in their 30s and 40s.
Yeah, and they're the ones that run 5 miles a day. Yes. They never throw up a red flag prior to.
They have sky-high cholesterols when they're 16, despite the fact that they're young athletes who eat well.
Yeah.
And so this is something that is it's a genetic disease, and we really want to be aggressive. So if a lot of people in the family have had heart attacks and have really high cholesterol levels, then even our young people, our kids, we want to get tested. And like Amber said, there's blood tests to even look for the genes so that we can tell you if you have this.
Even in our pediatric population, because we do see pediatrics here, there are certain indications where we start checking cholesterol as early as 9 based on those recommendations because of family history and obesity and things that even pediatric patients were experiencing
Yeah,
now
and
that
we're
we didn't
seeing more kids
forever
with
ago.
high cholesterol.
Yeah.
You know, unfortunately, we're a fast food country, and there are a number of other things that even with lifestyle, when it's not familial, even with lifestyle, we're seeing younger people with higher cholesterol, and so that bridge to the heart attack is going to happen at a younger age. So certainly, we hope that everyone appreciates that if you keep a high cholesterol, you are clogging your vessels. And if you clog your vessels, you will end up with a heart attack or stroke. And these are horrible things with not good outcomes.
Yeah, and we love our patients. We love you guys. We don't want you to have to suffer. It truly is suffering from a heart attack and stroke.
Something that we can prevent.
Yeah, and
something that we can
totally
be on
prevent.
top of and prevent.
Yeah.
And so we hope that you really understand why this matters. You want to know your cholesterol numbers. If you're an adult, you need to know what your cholesterol numbers are. And if the numbers are high, don't go in with the I'm not going to do that. Really take the approach of how am I going to prevent? Nothing bad has happened. That's fabulous. How am I going to make sure that I can continue to say that?
Yeah. So we want you to care about cholesterol like we care about cholesterol.
Yes. Thank you for joining us today. We hope that you have been able to appreciate why your cholesterol matters.
We like to leave you on a good note. Today's Tell Me Something Good comes from Dr. Plaster.
I think Something Good is unsung heroes. There are so many people that are doing amazing work and we forget to appreciate them. The trash people, the mail people, people who are in our community that are doing jobs every day. So appreciate and show appreciation for your unsung heroes. Thank you for joining us today, and until next time, take care of yourself.